Hi, welcome to Well Rounded Momma's YouTube channel. Thanks for joining us. If you find this video helpful, like, subscribe, ring the bell. My name is Sherry and this is Sarah. We are both home birth midwives in the Las Vegas area. Today, we're gonna answer one of the most asked questions that happens in a consultation, and that is, what if something happens? What if something goes wrong?
Yeah. Probably first and foremost, you might not know right away just based off of our face. We usually stay pretty calm throughout any sort of emergencies. We don't need to also be the people freaking out. We've all been trained in birth emergency skills, and so we know how to stabilize somebody before EMS or anything like that would be called. Usually in any of the emergencies I've been at, speaking from personal experience, we've always been able to stabilize someone before EMTs even arrived.
For me, there's I wrote some stuff on the board to keep me on track. The first thing is our training.
I didn't even read it.
Our training is specifically for out of hospital births. And so I think the biggest misconception that individuals have is that you're just taking that hospital birth and you're doing it in a home birth setting. And that is not at all what we're doing. We are doing a home birth in a home birth setting, or an out of hospital birth in an out of hospital setting. That's what we're trained to do. So sometimes in a hospital, they have the ability to push the envelope or do things that might put you at a greater risk of things because they do have that OR up the hallway, or they have that ability to take you back. At home, what we've been trained to do is recognize anything that is out of normal and not push that envelope. We work with one of the perinatologist groups in town, and one of the physicians that joined them at first, I had requested something specific in an ultrasound and he didn't do it. I called and I said, "You didn't do the thing I asked you to do?" And he goes, "Well, because it doesn't really matter." And I said, "No, it matters in a home birth setting." And that really opened my eyes to this idea of, oh yeah, like most physicians and probably humans that aren't midwives or familiar with home birth, they probably think that we're doing the exact same thing that happens in a hospital. And we just aren't. We are specialists in normal physiological birth. I have to say, like 90% of the time, birth just happens organically, spontaneously, and it doesn't matter if my 8-year-old granddaughter was there as your midwife because nothing needed to happen. You just want us there for that 10 to 15% of the time that some type of intervention needs to happen. That doesn't mean 10 to 15% of the time something crazy is happening. It just means 10 to 15% of the time we might be doing something besides sitting on our hands.
Yeah. We might be stimulating a baby to help them breathe. We might be doing a little bit more active management to help make sure that someone isn't bleeding too heavily.
Or a vaginal exam.
Exactly.
Or that is what our training consists of. The reason why I thought about making this video is like last week we were in workshop for 4 days. But as CPMs, we are required to do 30 continuing education credits every 3 years. Most of us have more than that, and every midwife you probably talk to takes continuing education classes. Like this week, we took a bunch of classes and workshops. Because we're only stepping in such a small percentage, it means we're practicing a lot. Practicing sutures and IVs and all of those things that we hardly ever do because we want to be sharp. We all have neonatal resuscitation training, which is neonatal resuscitation. So there's a difference between like adult and child and infant CPR and then your neonatal. It's very different. And so the same training that your nursery nurses have to handle a hospital situation is the same training we have.
Really, a home birth midwife is doing 3 different jobs, essentially. Like we are doing essentially the nurse's job, the obstetrician's job, and the immediate like pediatrician or baby nurse's job. We don't just like show up and catch babies and like we're out. Like the majority of what we're doing is just making sure that everything does stay within that realm of normal.
Kind of here at Well Rounded Momma, we like to be within 30 minutes of a labor and delivery unit. That's been like a really important thing to us. Sometimes we do break that rule, but a lot of our emergency skills training is for those midwives that do live rurally because they don't have the same luxury we do. We have this 6 to 8 minute response time for EMS.
We can usually get someone to a hospital really fast if we need to. Luckily,
especially because we can call ahead and they'll just meet them in the OR. Birth works. And if we leave birth alone, the body constantly tells us what's going on with mom and baby.
And I think that that is an important distinction to remember. When I was in my apprenticeship with you, we had a client who was not getting great fetal heart tones and they needed to go to the hospital. But once we got there, the nurses were like, "Oh, that's a totally normal like deceleration pattern." And we're like, Not for home birth, it's not. And I feel like our numbers really speak for themselves. Like there has never really been a time where we've gone, oh, maybe we shouldn't have transferred for that reason. Like it always ends up like something ended up developing and we figured out why a baby was having that problem and feel pretty confident in our ability to make that call.
Body autonomy is so important to us, but on that equal level, having a positive birth outcome and not being part of somebody's story of trauma. Sometimes that happens though, because sometimes people transport and that's a disappointing thing. But yeah, that's kind of our story and we're sticking to it. That's what happens when something happens, is it doesn't happen very often. But if you ask your midwife or care provider, what do you do in the case of whatever? I think it's important to talk about. Don't just make assumptions. Don't assume that your care provider knows how to handle certain situations. If you're worried about something, if something happened to a family member or you read something, go to your care provider and ask, what do you do in that scenario? Just remember, midwives, home birth midwives specifically, we are specialists in normal.
And we are not afraid to answer those questions. If you have a mom or a partner or somebody who is really scared of emergencies and wants to be talked through what that would look like if that came up, we have no problem answering those questions. We don't care if we get drilled for a few minutes.
Yes. Thanks for joining us today. Oh, I kind of don't know how to close up. Thanks for joining us. We sure love you guys. We get the best feedback from you guys, but nobody ever likes or subscribes to our channel. I have to like start offering something. I don't know. I will come to your house and do your dishes if you like and subscribe.
Don't promise that. It's going to be a lot of likes.
That's our answer to what if something happens. Join us next week. That's what she said. I'm like, what is that? People in the videos are like, why? Congratulations. I wanted to swear so bad, but I was like, ooh, children may be watching. We could have a disclaimer in the videos. I'm just going to retire and be postpartum midwife, immediate postpartum. I come in, I clean up all your stuff. You're welcome. I'm really good at getting blood out of stuff.
You should just work crime scenes. Could be one of those crime scene cleaner-uppers.
Oh, but I feel like that would get gross.
Yeah.
I feel like women laboring, there's a very specific type of aftermath.